patient's coming in for evaluation and having this dealt with that's been into her nose. How long's it been there now? Quite a while, like months.
Yeah, months, yeah.
So this is in
Just kept getting bigger.
So this is a cyst, almost similar to a milia, which is more in the pilosebaceous origin. People misname lots of cysts sebaceous cysts, but this is one that might be actually appropriately named. So it's very difficult. This area is very, very sensitive from an anesthetic perspective and a painful perspective. So what we're going to try and do is putting local in here, when all I need to do is unroof this. I just need to puncture this a little bit. I'm just going to try and use a topical anesthetic and see if we can freeze that enough where I can just pick that away a little bit so we can express that. These smaller ones, we don't need to take out the entire capsule for reasons I'm not entirely clear on. When we just rupture the small ones, it's sometimes enough damage that the capsule doesn't come back on them. So in terms of instruments that you want to have, what I find highly used for these is just a needle, because it's very fine, because I'm going to use that to unroof it, just to pick that away so it's easy to work and you can utilize it like a pen. And then you want to have a pair of pickups that you can squeeze this with. So generally I'd want to have a pair that's longer like this, medium width, and then I have a small pair if I need it. Sometimes you'll be surprised on what grabs it better than not. These will probably be fine, but we'll see what we have to use here. So then we want to try and just plug her nostril here. I'm just covering her eye there. Don't want to get wet. I'm just going to use this topical. You okay? You okay there?
Mm-hmm.
And do a little bit more because I want to freeze it. Just keep that there. Good.
Oh.
You okay there?
Okay.
You okay?
Yeah, it's just that I was swallowing that.
Is that hurting?
No? No?
So once I unroof that, I want to see if I can express it. Just like that.
Wow.
So even though we didn't get a capsule out in that particular case, usually that should be sufficient that this won't come back to the same degree, if at all. So now we'll just put a dressing on that and that's it.